nobody likes having a chest tube emergency, but if you do, let's talk about some emergency equipment that you should have at the bedside readily available. Not even joking, a couple months ago, I was helping on a patient that was not mine. I was just assisting. We were turning this patient and their chest tube fell out. Now, in hindsight, we realized that that chest tube was actually already coming out kind of dislodged on that patient. But regardless, we had our emergency equipment available. We were able to address it. The first chest tube emergency you may have is your chest tube falling out. For this, I like to make sure I have some 4x4 sterile gauze as well as some tape. Now, depending on where you work in the hospital policy and the provider's preference, they may want you to do a 3-sided gauze tape. So your chest tube comes out, you take that 4x4 gauze, you put it right on the insertion site, and you only tape it on 3 sides. That way, when your patient exhales, air can escape, but when they inhale, that gauze suctions up against the site and it doesn't draw air back in. Some providers prefer the 3-sided gauze. Others prefer an occlusive dressing. So same concept, except you're just going to slap on that petroleum gauze over the site, put a 4x4 gauze over the top, and tape it on all 4 sides. It's typically a question I ask a provider whenever we're putting in a new chest tube. I say, hey, in case of an emergency, what's your preference on how you'd like that site secured if the chest tube comes out. I also like to throw some hemostats in there in case we need to clamp the chest tube. This doesn't happen very often. It's very, very rare, but just in case, I like to have it available. Now, let's say your chest tube stays in, but the atrium gets disconnected, or you have a disconnect somewhere. The sterile saline comes in place whenever that happens. Actually take the end of the chest tube and place it in sterile saline. This is like a temporary water seal chamber until you can go and grab a new atrium and get it all set up. Also throw some alcohol swabs in there because sometimes you will get that connection that just disconnects really quick and you need to, plug it back in, but I want to quickly clean off that site. Make sure you're allowed to do this with your hospital's policy. Sometimes your chest tube might get disconnected. If it's in ooey gooey stuff all over the floor, probably just best if we grab a whole new setup instead of reusing that one. But those are the chest tube emergency supplies I like to have at the bedside in case I have an emergency. Let me know if you have any questions.